May I proceed? Please introduce yourself.
My name is Reese Lindsay.
How old are you?
16.
Where do you go to? Where do you live?
I live at the dorm at our school, a university, college.
So you're a college student?
I am.
What are you studying at
I'm a
college?
pre-med student.
Do you have any plans after college?
I plan to go to med school.
Any particular med school?
I got accepted to Stanford.
Congratulations,
Thank
Reese.
you.
Now, I want to move on to why we're here today.
Okay.
Who is Taylor Warren?
She was the young lady I met at the school that I go to. She worked in the counselor's office, and spoke to her outside of my counseling, and I will actually visit the counseling office more frequently to see her.
How did your relationship progress with Taylor?
We became very close. She was actually the only person at the school that I actually became close with. She was always quiet and shy, and yeah, we became good friends.
Was Taylor healthy?
No, she was sick. She had kidney failure, disease, something.
Was there anything you could do to help her?
I went and I could give her a kidney. I could participate in a kidney transplant and give her a kidney.
And did you do this?
I certainly did.
Whose decision was it to give Taylor your kidney?
It was mine.
Was it only your decision?
Yes,
Did you talk to your parents about this?
I did, but they overreacted like always.
What do you mean they overreacted?
Dad's a bit of a pansy, lets mom do what she wants.
So then did you talk to anyone else about this surgery?
I talked to my counselor,
Anyone else?
Taylor.
Did the hospital talk to you about the surgery?
They did. They told me all. They did tests to make sure it's matched. Did the videos that they make you watch, signed papers, things of that nature.
What did the videos talk about?
The risks that are involved with the surgery, what your life will be like after you give a transplant, and things of that nature.
And after you watched those videos, did you still decide to go with the surgery?
Absolutely.
Now, you also mentioned that the hospital made you fill out paperwork. First of all, what was the name of the hospital?
Allister City Hospital.
And you mentioned that they made you fill out paperwork.
Hmm.
Were you complete and accurate on your paperwork?
I answered all the questions.
Okay, well, let's talk about what those questions were. Reese, are you familiar with your medical history?
Not up until recently.
What do you mean by that?
Well, I found out that after I had the transplant, that I had the gene for polycystic kidney disease.
And you said you didn't learn of this until recently. When exactly did you learn that you had polycystic?
It was after the transplant.
After the transplant. Would this have changed your mind about the transplant had you known it before?
Not at all.
Now, on these forms that you mentioned, did it ask for your birthday?
It did.
What did you fill out for your birthday?
The month and day.
Did you put the year?
I did not.
What age were you at the time you were filling out these forms?
16.
Did you tell anyone that you were 16?
I did not.
If the hospital had asked you your age, what would you have told them?
I would have lied and said I was 18.
Did your parents tell the hospital you were 16?
They didn't know I was getting a transplant, so they didn't have reason to tell them I was 16.
So then after you were done filling out the forms, did your parents sign the authorization form?
They didn't. They assumed I was of age. They didn't need my parents' consent.
So did you sign the authorization
I
forms?
did.
Were your parents at all involved in this surgery at this point?
Not at all.
Reese, you mentioned you're interested in going into the medical field. As a future doctor in this country, would you hope to trust what your patients told you was true?
Absolutely.
And would you rely on the information your patients gave you to treat them?
Yes, because the information they provide me would be, they have their reasons for telling me the information.
And as of today, sitting here in that stand, do you have any pain?
No, not at all.
Are you suffering?
Nothing more than the incision, but other than that, no.
Do you need medication?
No.
Do you need treatment?
No.
Thank you, nothing further.
Dun, dun.
Your Honor. Reese, you're 16 years old, correct?
Correct.
And you've never gone through with a court process to emancipate yourself from your parents?
I've thought about it several times.
But have you ever gone through with the process?
No.
So technically you're still a minor.
Yes.
Right. Are you aware that the law in South Texas says that you can't operate on a minor unless you get permission from their parents?
I guess it is.
Isn't that exactly what happened in this case?
What, that the law says?
No, that Allister City Hospital operated on you without your parents' permission.
Yes.
But you maintain that the hospital did nothing wrong, correct?
Absolutely not.
Because you're just trying to help your friend Taylor out, right?
They're trying to do a good thing, yes.
Let's talk a little about your health. You're a carrier for a disease, PKD, isn't that right?
Yes.
And that's the disease that killed your birth mother?
It's a little bit murky on that, but it's safe to say it may have contributed.
Reese, would you agree with me that giving away an organ can be risky?
Everything has risks. Walking, eating, breathing. You buy a pool next day, you hit a rake, and you go.
Would you agree with me that giving away a kidney when you're genetically predisposed to kidney disease can be risky?
Possibly yes, but it's still a risk I'm willing to take.
Now, you just testified that at the time of the transplant, you didn't know that you were a carrier for the disease, did you?
Correct.
And you also testified that it wouldn't have changed your mind.
Correct.
But isn't it true that because you didn't know that you were a carrier of the disease, you didn't fully appreciate the risk you were putting yourself?
Well, I think that appreciation would come in the form of regret after I've done something, but I feel no regret for it.
Let's talk a little bit about why you decided to give away your kidney. You met your friend Taylor Warren at a counseling center, right?
Correct.
And you go to this counseling center because you've had a hard time getting along with others, isn't that right?
Yes, and more likely my parents overreacting again suggested that I go to counseling.
Actually, you don't have very many friends, do you?
No, you would have been asked about it.
Except for Taylor.
Correct.
And y'all are very good friends.
Very good friends. I gave her a kidney. Happy birthday.
So as y'all became friends, y'all became very close, correct?
Correct.
And y'all would talk every day
Every day.
about everything.
Everything.
But she was sick, right?
That's why I gave her a kidney.
And you didn't like seeing her sick.
No one likes to see their best friend sick.
You would do anything to help her out if you could.
Absolutely. I gave her a kidney.
Let's go back to the transplant process.
Okay.
Before the transplant, you had to have a blood test, correct?
Correct.
You also had to have some checkups.
Correct.
You also saw some counselors.
Correct.
During this process, you filled out forms, right?
Correct.
And on these forms, you didn't include your birth year.
Not my birthday, no.
Reese, did anyone ever follow up on the incomplete forms?
No, they didn't.
And no one ever sat you down and asked you how old you were, did they?
They didn't, but if they did, again, I would have lied.
No one ever asked to see your identification.
No, they didn't.
So during that entire process, no one ever confirmed your age, did they?
No, they didn't.
No further questions.
And your redirect? Yes. Just a moment ago, you said that you don't blame Allister Hospital for the surgery.
I don't.
How much are you hoping to get out of this lawsuit today?
Hope parents fell miserably getting that.
Thank you. Nothing further.
Witness may step down
Did I?
and
Did
is excused.
I get the?
5 minutes, 30 seconds. Dakota, you were at 3 minutes and 50 seconds.
Did I get my resentment across? I was really, really trying to channel the hate.
What's 717 area code?
7 what?
717?
No, 7-4.
California, I think it was California 701.
No,
717?
Yeah.
I was looking for a good time. We had 13 on one better.
Whoever's up supposed to up there, we don't want to speculate. That was the best.
That's Pennsylvania.
Hey, what?
Oh.
You're good.
All right, it's been fun kicking it with you guys.
Yeah, thanks.
Must be an adult.
Still love you.
Good luck, you guys.
Thanks, Ryan.
No problem.
Charleston.